We're now just going to run through cranial nerves 1 to 12 as a checklist how to examine them. Start by washing your hands, introducing yourself, confirming the patient's details, explaining the examination to gain informed consent, position the patient comfortably on a chair and ensure you have the appropriate equipment. Perform a general inspection, looking for any clinical signs suggestive of underlying pathology. For the first cranial nerve, the olfactory nerve, ask the patient if they've noticed any recent changes to their sense of smell or taste and examine the smell with formal sense or use the UPSIT test. For the optic nerve, which is examined along with the oculomotor trochlear and abducens nerve, start by inspecting the pupils, assess for visual acuity, assess the direct and consensual pupillary reflexes, perform the swinging light test, assess for accommodation, colour vision, visual neglect, visual fields, examine the blind spot and offer to perform fundoscopy. Inspect the eyelids for ptosis and examine eye movements as well as any evidence for strabismus. The trigeminal nerve should be examined by first assessing facial sensation in the regions of V1, 2 and 3, in the forehead, cheek and lower jaw, assess the muscles of mastication by inspecting them and testing them, as well as examining the jaw jerk and corneal reflex. For the facial nerve, ask the patient whether they've noticed any changes to their sense of taste or if they've noticed any changes to their sense of hearing, particularly for loud sounds. Inspect the face for any obvious asymmetry at rest and assess the facial movement by asking the patient to perform various facial expressions and examine the external auditory meatus. The vestibular cochlear nerve, gross hearing should be assessed, followed by the Rini and Weber's test, and then perform vestibular testing by using the Unterberger test or turning test, as well as examining the vestibular ocular reflex. Cranial nerve 9 and 10, the glossopharyngeal and vagus nerve, are examined together. First, inspect the soft palate and the uvula, ask the patient to cough, perform a swallow assessment, and offer to perform the gag reflex. The accessory nerve, or the 11th cranial nerve, is examined by inspecting the sternocleidomastoid and trapezius muscles for their strength. The 12th cranial nerve, the hypoglossal nerve, is examined by inspecting the tongue for any signs of wasting or fasciculations. The patient is then asked to protrude their tongue and there's observation for any deviation or tongue atrophy, and the tongue strength is assessed by asking the patient to push into their cheeks on the left and right side. To complete the examination, thank the patient and explain to them that the examination has now finished, summarize your findings and suggest further assessments such as examining the upper and lower limbs and offer relevant investigations and a management plan. Thank you for attending this medicine masterclass.